Now, changing to high blood pressure, there was a study that talked about the use of an ACE inhibitor, and that's lisinopril or monopril or quinapril or acupril or Altace or ramipril, and all of those are the ACE inhibitors, and they're very good at treating high blood pressure, and they have certain other biochemical effects. We use the fancy word pleiotropic, P-L-E-I-T-R-O-P-I-C, which means other than the main factor that you're looking at. And these pleiotropic effects have other side benefits. Well, when you put together an ACE inhibitor like Altace, ramipril, Acion, acupril or quinapril, monopril or benzapril or fascinapril, lisinopril, Preventive, all of those are the ACE inhibitors. And when you put those together with a calcium channel blocker like generic Norvasc, you may have a better result in controlling blood pressure and reducing heart attack and need for bypass surgery and reducing the need for stroke than if you just use a water pill like HCTZ or HCT or aldactazide or spironolactone HCTZ. So the point being that the addition of Norvasc to an ACE inhibitor may be better than the use of a diuretic with an ACE inhibitor. Also, I want to talk about, excuse me, outdated medications. Now, do you have a piece of wood in your house? Do you have a piece of stone in your house? Do you have a piece of metal in your house? Have those things like fallen apart or degraded? And you may say, yeah, that chair is really a mess now. No, but the wood is still wood, the leather is still leather, the metal is still metal, and that's the way I feel about medications. Now, I am not promoting the use of outdated medications, but currently I believe that for some reason the government is in lockstep with the pharmacological companies, the big pharmacy, in saying medications are outdated, and it is my belief that such is not the case, that those medicines are just fine. That is not always the case. There was a medication called tetracycline, and outdated tetracycline caused a kidney disease called Fanconi syndrome. So there is a degree of truth, but the last research, as best I know, was done in the 1980s, and nobody has done any research to show that the medicine you have in your medicine chest that's 8 years old is still just fine. And it is my suspicion that such is the case. Well, suspicion, what are the facts? And the answer is the only thing that is the facts is there are laws, probably not based on any science whatsoever, about medications having expired. As for the use of generic medications, now I think there's a time and a place when that is in fact the case. If you had to choose between Toprol and atenolol, they are both, atenolol used to be called Tenormin. If you had to choose between Tenormin/atenolol versus Toprol or metoprolol succinate, I certainly feel that the generics are just fine. But are those two medications as good as Bystolic or Coreg or Carvedilol? And my firm belief is no. Bystolic is a better medication than atenolol or Toprol or even generic Coreg, but at least generic Coreg is better than atenolol and metoprolol succinate. So what I'm saying is that yes, generics, even within the class of generics, there are some that are better and some that are worse, but do I think that some non-generic, some, not all, I'm perfectly happy to use any of the generic ACE inhibitors, and I gave you that whole long list, but I'm not perfectly comfortable using the beta blockers, which is the Toprol, Tenormin, atenolol, as opposed to Bystolic. And I do think that Bystolic is better because it has a better effect on mood, it has a better effect on psychology, it has a better effect on dream state, it has a better effect on sexual ability, it has a better effect on producing nitric oxide, which opens blood vessels up. So I think that Bistolic, and yes, I have been a speaker for Bistolic. The company that produces that has hired me, but this is my opinion. I wouldn't speak for those companies if I did not believe that they were superior medications. I've had some patients who can't tolerate it. I've had some patients who can't tolerate anything. I've had some patients who said to me, I don't like Bistolic, I want to go back to Toprol or Atenolol. But the thinking, the theory that doctors are supposed to be using should be such that you understand the physiology. And the good thing about Bistolic and Carvedilol, Coreg, is that they have better effects on insulin. They don't reduce what's called the cardiac output. They are the calming variety and bring down the heart rate. So they are good for arrhythmias, or work in arrhythmias, however you want to say that. But I think there's a time and place for some generics, but not all generics. I prefer the angiotensin receptor blockers, which are not generic, because I have fewer calls back from the patient. They are less troublesome for me when I can recommend that a person take Benicar or Diovan instead of all that long list of ACE inhibitors that I gave you. They don't have to be monitored as much, and I believe that overall they're less expensive, but the HMOs think that they are more expensive, but they're not looking at how often those patients develop adverse reactions, and then that has to be worked up, and then the patient is uncomfortable, and this goes on for a few weeks before the patient and the doctor recognize what the problem is. And I do believe that the HMOs should be more tolerant without needing to go through the clearing process, which is really a pain in our office. It is not simple. So yes, brakes need to be put on somewhat, but I think that doctors should be allowed to make more of those decisions than these HMOs. But you know, money talks, and doctors just have opinions, so that's what I'm doing. I'm giving you my opinion.